Dr. Claytor here, update on deep plane facelift. A lot of talk out on the internet today about the difference between a deep plane facelift and a SMAS plication. Here is what we call the SMAS, the superficial muscular aponeurotic system, and it's between the skin and the deeper tissues. The majority of facial plastic surgeons who are doing facelift surgeries today, who are working to lift this area, are concentrating on the deep plane technique. And really the reason for that is it's just much more durable and it's delivering much more predictable results. For the deep plane technique, you would make your incisions along the hairline, along the ear, either in front of the tragus or behind the tragus, down back behind the ear and into the retroauricular region. Then you dissect subcutaneously to the level of the entrance to the SMAS. And now you're going down underneath it. And the importance of this is that as you're going along, you're finding these retaining ligaments. And these retaining ligaments are what are keeping you from lifting up that SMAS. And I think those are some of the shortcomings when individuals try and do a SMAS plication. For the SMAS plication, here's your incision, and you lift and you reflect the skin. This is again one of the shortcomings that I feel about SMAS plication, because you have to lift so much of the skin up off of the SMAS. I think it can have some long-term detrimental effects to the health of the skin, the integrity of the skin, to dissect all this. But that's what happens in the SMAS plication. You need to lift it up. So now you're looking at that SMAS and you plicate it. So imagine just grabbing it and pinching it together. So we would take sutures and we would suture from here to here, here to here, and that pulls that tissue up. You're just lifting that tissue up. You're not dissecting underneath it. You're not releasing any of those retaining ligaments that we were talking about that are here, here, and here. None of those retaining ligaments are released when you're doing the SMAS plication. And then you take that excess skin, you lay it down, and then you cut off the excess skin. So by pulling this up, you're grabbing there and lifting that SMAS upwards. So again, I think some of the shortcomings of the SMAS plication is that you are not releasing these retaining ligaments that are deep to the SMAS because you never see them. Here in the deep plane technique, you dissect just about this far, about 3 centimeters anterior, and that's all the skin elevation you're doing. Then you go deep to the SMAS, and we're going up underneath it. And when you're doing that, you're going along, and that's where you're finding these retaining ligaments, and you're able to identify them and transect them. And when you do so, now there is tremendous mobility to that tissue, and you're able to lift up the tissue as a composite flap. Composite flap may be a slightly confusing term, but what it means is that there are 2 tissues together, not separated. The overlying skin is still together with the SMAS. That's what makes a composite flap. It does a lot of things. Much less bruising and much healthier skin flap because it is maintaining that blood supply, that nerve supply to the outer skin layer, which I think keeps it looking healthier long term. And also it provides an area, if you wanted to fat graft into there, you could fat graft between the skin and the SMAS. That's not something that you can do if you do a skin lift and a plication, because where are you going to put the fat? You've lifted and interrupted that layer, so there's nowhere to be putting that fat. What happens down in the neck, because many patients today are like, hey, we gotta address my neck. I continue from the SMAS down into the neck, which is the platysma muscle. Many times patients will come in and say, I have these platysmal bands, how can I get rid of them? The SMAS is contiguous with the platysma muscle, meaning they're the same structure, but they look a little different. This is aponeurotic tissue, whereas this is muscle tissue. It's the same layer, and so as we continue down there, it gets lifted and also pulled together. So we're tightening the neck as well as the midface. This also gives us access to get down and address that submandibular gland. This is a huge topic. I firmly believe this is something that you should consider, and you should find a surgeon who has the skill and the comfort level to address this, because this is how you're going to really achieve that super sculpted jawline. Back to the platysma muscle. So you go down here, and there's also a retaining ligament here that you want to release. And when you do that, now you're able to lift and pull all of that tissue, and it gets inset into here. So you're lifting all of that tissue after you've released the retaining ligaments. So I think the big take-home difference between a SMAS plication and a deep plane facelift is the SMAS plication, first of all, delaminates a lot more skin, and I think interrupts that blood flow to the skin. Number two, the deep plane technique releases the retaining ligaments, and it keeps that overlying skin in contact with the SMAS, improving its blood supply, improving its nerve intervention, which makes it a composite flap and has much more long-lasting viability. And you can also fat graft into that layer because you've maintained that layer to be acceptable for fat. So, hope you found this helpful. Big difference between SMAS plication and deep plane facelift. Thanks so much for watching.